Okay, so for this last video, we're talking about everyone's favorite thing, infection control. Um, so stay tuned for infection control when it comes to PFTs. It's pretty straightforward, not going to be a super long video. Excuse me, I did include the references from the last few videos. I mostly obtained all my references just through the PowerPoint presentations that were provided for us in class, and then also respiratory videos that I watched regarding PFTs, which I had actually watched before when I was studying for the TMC, and so I just kind of went back through and rewatched some of them, and then provided them here. So yeah, my name is Elizabeth Locker, and please stay tuned. Okay, so we're talking about infection control. These are just some key guidelines to follow. So some key guidelines for infection control is to use universal precautions and expanded precautions if necessary. If you're suspecting any infectious airborne disease, you should obviously wear an N95 respirator. Mouthpieces or flow sensors should always be disposable or disinfected between patients. I've never seen them disinfected between patients. I've always seen them as disposable, where the mouthpiece completely comes off and gets thrown away after each patient use. And I feel like that's probably the most cleanseless or cleanest way. I can't talk tonight, sorry, but the cleanest way. And then the nose clips, the mouth seals, the valve holding chambers, and the small volume nebulizers all should be disposable and single patient use. So the nose clip is just what they put on the patient's nose during testing to help them breathe through their mouth to assure better accuracy. The valve holding chamber is what they sometimes use for MDIs to just increase efficiency to aerosolation to the lungs. And then a small volume nebulizer is typically what they'll use when they're giving the patient a bronchodilator to see if they have partial or full reversibility when it comes to their FEV1. And those should always be single patient use. There's single patient use in the hospital as well. Those are not shared between patients, and they should never be shared between patients. And then the use of inline filters does not eliminate the need for regular cleaning and disinfection. So this means that in between each PFT, we should be disinfecting and wiping down all of the equipment. And then when administering aerosolized medications, the most effective way to avoid cross-contamination of the drug would be to administer it with an MDI. So aerosization is great. A lot of times patients prefer that. And it does, the small particles can help get down to their lungs. But when it comes to cross-contamination, an MDI is always going to be a better source of treatment to reduce infection. So those are just some key takeaways to keep in mind. Yeah. Lastly, for references, like I said, for pretty much all the videos, I used the PowerPoints that were graciously provided. They were very in-depth. I went through each one of them, read through them, and then kind of picked away the key points that I could take from them. And then I also used respiratory coach videos that I had previously watched. I just kind of rewatched them. Respiratory coach has a PFT series. And so when I was first starting in school, I watched them, and to be honest, they didn't really make much sense. And then gradually, over the course of this program, I have rewatched them, and they made so much more sense. And that was honestly kind of reassuring that something that didn't really make much sense to me at the beginning now makes complete sense to me. So yeah, thank you very much.